covering the stories that impact your life, your town, your state, and your future. This is the Means Report with your host, Brad Means.
Hello, everybody, and welcome once again to the Means Report. We certainly appreciate you spending part of your day with us, where today we have yet another information-packed edition of the Means Report for you. We're going to catch up with our friends at Christ Community Health Services, where it's all about providing medical care for the underinsured. You know, a lot of people may not have the access to health care that you do, but there's a place in town that can help those folks. And you're going to see some brand new faces when we talk to our Christ community friends. And so I want you to meet them, and I want you to understand and appreciate what they do and hopefully support them in their efforts, because they are great folks. Also, we thought that Memorial Day would be a great time to honor our veterans. And even if this re-airs down the road, it's never a bad time to pay tribute to those who have protected us. And we're going to talk about that with a chaplain from the Charlie Norwood VA. And of course, we're going to wrap up the Means Report, as always, with ways that you can keep in touch with us and help us get more great guests like the ones we have today. Will Jackson III is the brand new CEO of Christ Community Health Services in Augusta. Will, welcome to you.
Thank you.
And Elizabeth Merritt directs the development and communications efforts at Christ Community. Thanks for being here as well. And welcome pretty much to you, because it hasn't been that long for you either.
That's right.
Will, let's start with you. I mean, it's been days since you came to Augusta to take the top job. What motivated you to say yes when they called you and said, please come down here and run this place?
Yeah, so only 35 days, but who's counting?
Yeah.
I think mission and moment for me was it. The moment was just right to have an opportunity to connect with an organization that has a mission to proclaim Jesus Christ as Savior and to demonstrate His love by providing affordable, quality primary health care to the underserved. That just resonates with me, including for my background. And then the moment, it was just a great season to come and get closer to home. I grew up in Columbus, Georgia, and so coming back to my home state and being able to lead a great organization that has a mission that aligns with me was just the right moment and with the right mission.
Well, we're glad you're here, and we welcome you. We have friends down in the Fountain City. We love Columbus, Georgia. We battle Columbus, Georgia constantly for the right to be the second largest city in Georgia.
Yes,
since,
I noticed that.
Atlanta, and then us versus Columbus. Elizabeth, let me ask you this. Something I noticed about Christ Community Health that I didn't notice the last time we talked to y'all was that you have 4 locations in Augusta. Why is that? Is the need growing that quickly where you just have to keep opening up new places for people to go get health care?
Absolutely. We hope to continue to grow to meet the need that's out there. We like to be located in the neighborhoods that need us the most. So our locations are strategically placed. We have one in South Augusta, one in the shadow of Piedmont Hospital on Datnack. We have a PEDS clinic next door to that. One in Old Town.
Yeah.
So we are located where the need is, but the reality is that we serve folks from 10 or more counties around the CSRA.
Well, what's the typical patient look like? Is it someone who just simply doesn't have health insurance and they know they can come to y'all?
Yeah, great question. So the typical patient actually could have either public insurance or no insurance. We do serve those who have private or commercial insurance, but many of our patients either have Medicare or Medicaid or no insurance. And so for those that have no insurance, we have what's called a sliding fee scale, where we take that classic doctor's office amount and based on their household size and income amount, we slide that cost down to meet them where they're at in their financial index, if you will, and that way they actually have access to affordable health care.
And then how do y'all get paid? The difference between that sliding scale and what the services actually cost?
That's a great question. So many times people ask, are you a free or charitable clinic? And we're not a free clinic, but we are charitable in terms of taking donations and whatnot. But truthfully, a lot of our income comes from your traditional forms of payment, whether it's public, private, or commercial insurance, and we're just good stewards of that to help us offset the cost of the uninsured. However, the federal government does give us some grants which subsidize what we know we are not going to get for those who are uninsured, and that's part of what makes us a federally qualified health center.
What's that look like behind the scenes, Elizabeth, when you're trying to navigate that red tape that is inherent in just about any interaction with the government? You need the money. Is it a lengthy process between, hey, Washington, D.C., help us, to the time where they say, okay, here's a check?
Fortunately, my particular position I don't have to do the paperwork for the federal and state
No,
grants, so
good for
I
you.
am thrilled about that. It is a tremendously difficult and intricate process. Even I do private grant applications, and even those can be challenging, but not the level of detail of reporting that we have to do for the federal and state money that we receive is extensive, but it does help ensure quality. I mean, the word quality is in our mission statement, and it's very important to us that not only are we providing care for people who may not be able to get it elsewhere, but the level of care that they're getting is very, very high.
Yeah, it's top notch. You know, Will, you mentioned Piedmont at the beginning of the interview. Do y'all have a good relationship with the hospitals here in town in case somebody's need rises to the level where you need to transfer them to a bigger facility?
Absolutely, absolutely. I've been blessed to learn early on that we have great relationships with Piedmont and Wellstar and Doctors Hospital, as well as local specialty groups. And that's really important for us because oftentimes there are needs that go beyond the services and the walls that we have. And so those relationships are important, whether it's an on-the-moment referral or whether it's a stepwise situation that warrants us to kind of walk them to a Piedmont or a Wellstar. And so we had great partners. In fact, recently started meeting with them in person just to continue to foster that relationship and grow it.
What about the dentistry component of Christ Community? Is that something that's keeping you all very busy? That, in my memory, is relatively new. How's it going?
Our full clinic got established in 2017 for dentistry, and
wow, 8 years already.
It is a huge need in the Augusta area. I believe this is not just in the Augusta area, but if you don't have insurance, your choices are limited. And dental care, when those of us who don't have dental problems sort of take it for granted, but when you have serious dental needs, they are fairly immediate. You know, if you don't get a root canal in a timely manner, you're going to lose that tooth.
Yep.
And a lot of our patients tend to be in a lot of pain. And so the dental clinic is extremely busy. And we are so blessed to have those folks. They are also top notch.
What about the faith-based part of what y'all do? It's in your name, Christ. Do you preach to your patients, try to convert them, make them listen to a Bible verse before their treatment? And I'm not trying to be funny.
Sure.
I just wonder how much of that is involved when somebody comes in and says, please, make me feel better.
Yeah, I think that's great. And I think you're asking about the secret sauce. I think it's the thing that makes us unique. And so when you walk in our environment, not only do you see mission and scriptures on the walls and in the hallway, but our providers and our front office staff and our nurses and even some of us administrators often are inviting our patients to pray. If we see life circumstances need not only medicine, but maybe some faith or a miracle, that we can either invite them to Jesus or we can just continue to pray with them or guide them to a local congregation if they're looking for some of those spiritual life changes. So it very much is in the air and the services in which we breathe and we provide, which is really unique and fun for me.
Well, I love that y'all do that. Are people, for the most part, receptive to that?
It's not only receptive, it's a driver for people, whether it's the staff that work at our organization, including myself, or it's the patients that we serve. There are many who love that they don't have to tuck away or compartmentalize the faith element of them. In fact, they can do that out loud while they're with their physician. And you better not let that provider try to walk out without praying for that patient, because they're going to say, hey, doc, you forgot something. You forgot to pray for me. So they look for this unique element of faith in our experiences.
How can the community help y'all do your job? I know you mentioned different sources of funding, both of y'all did, but what can we do to rally behind Christ Community Health, Elizabeth?
We have tremendous support in this community. I've just been blown away by it. We do depend on private donations as part of our funding, and we have families that give to us on a monthly basis, so we call them Christ Community Champions, and we love that, and that goes such a long way. But any individual gifts are welcome. Any amount, it is precious to us, and we do not take that for granted. Businesses a lot of times will support us with sponsorships. We have 2 major events in the fall for which we seek sponsorships, and that's another wonderful way that people can support and rally around us. And that is what drives us to do the patient care that we're able to do.
Well, when you look out at your entire team here in Augusta, all the men and women who make Christ Community what it is, what motivates them to do what they do when they're in med school and they're trying to figure out their future, and they say, you know what, I want to come to Augusta and work in this environment and provide these faith-based services? How do they have the heart for that?
Yeah, it's a great question. I think it's a back-to-back home run for them. You know, most individuals who are in a service organization are looking to meet a need, and so healthcare does not have enough providers or professionals, and so we know that our clinicians and our staff are literally meeting needs that are essential for life, liberty, and the pursuit of happiness, right? Like what we're standing on in our country. But also the missional part is very unique for many. And Jesus said, when you do unto the least of these, it is literally as if you're doing unto me. So for many who want to serve Christ, not just on a Sunday or on a Bible study midweek, but actually in their day-to-day, doing it in the walls of an organization that's living and breathing the faith of Jesus Christ out loud is really a driver. And so we have many residents, when they see that mission alive, they say, this is exactly what I want to do. And we welcome them. And there's over 100 faith-based health centers like us around the country. So we want them all.
Yeah.
But if we can't get all of them, we know that there's a place for them somewhere in this country.
I'm so glad that y'all do that. And I thought of one more question before I let y'all go, and I can't ignore our medical school students. Do they get a chance to come over and do rotations or just watch y'all work? Are y'all part of that world?
Absolutely. So, and Elizabeth will speak more, but the short answer is yes.
Yeah.
We actually have residencies and rotations with the different school organizations here, whether it's medical or dental.
So we have regular rotations from MCG. So at any given time, we'll have one MD student from there and one PA, physician assistant student from Augusta University. We also have NP students rotating. We have dental students rotating. We have physical therapy students doing training and serving our patients. So we are busy. We had over 200 students from MCG/AU just last year.
Oh, that's
it's
wonderful.
a great partnership.
Yeah, no, getting the future leaders educated and ready to practice.
Yeah.
Will Jackson III, Elizabeth Merritt, thank you all for being with me today. Very informative, as I told y'all it would be. Thanks for your time.
Thank you. Thanks for having us.
Appreciate it.
Absolutely. When we come back, we're going to honor our nation's veterans, find out what Memorial Day means and what the folks who did serve need from us on the Means Report.